Welcome back, everyone. A government-appointed advisory group is arguing against routine testing for children with autism. However, a national organization for the disorder says that the Fed's statement is misleading.
KTK's Kara Pritchard spoke to our local treatment center to get their response, and here's what they had to say. Kara, what's going on with that?
Neil, Casey here at the Treatment and Learning Center for Children with Autism. They focus on treatment specific to each child, and they say early intervention is vital to the child's development. So, of course, screenings is nothing but of benefit.
60, good job.
John is in the middle of his discrete trial training, which increases his motivation and learning, something that's tailored specifically to him.
When you start looking at challenges, when you start looking at skill deficits, when you start looking at symptoms, every child is so unique and different from the other.
Because autism looks different in each child, the American Academy of Pediatrics suggests testing for the disorder should be routine for doctors.
As someone who works with children starting as early as they are diagnosed, I can tell you that that is true.
However, the U.S. Preventive Services Task Force says there isn't enough evidence that the benefits would outweigh the harms in screening children, advocating for more research and larger studies.
Well, unfortunately, autism is there's still not a lot known about it, so a cure has not been created. As far as diagnosing, like Janessa said, it's still pretty subjective.
Sherman says the most important issue is treatment in schools and funding.
Children who do not have private insurance, Medicaid does not cover applied behavior analysis therapy, which the Surgeon General states that it is the most effective treatment for autism.
So if a child does not have a formal diagnosis, insurance doesn't cover it.
Because research shows that a child at 2 years old needs 30 to 40 hours a week of therapy for 2 years to make progress to where they're able to participate in the general ed classroom.
The key here in addressing our challenge as a nation, this rising health challenge, is awareness.
Now, just to note, about 1 in 45 children were diagnosed in 2014. Now, that number is way up from 1 in 150 back in 2000. Now, for more information and red flag characteristics that a young child with autism may have, visit our website, myeasttex.com. Reporting live in Tyler, Kara Pritchard, KETK News.